Hi, this is the breast lift presentation as part of the online seminar series by West County Plastic Surgeons of Washington University. A breast lift is one form of breast rejuvenation cosmetic surgery. There are several important things to know about breast lift surgery, including where the scars are located, when one would consider a breast lift, what the differences are between a breast lift and a breast augmentation, whether breast lifts affect the development or detection of breast cancer, and then what to expect with breast lift surgery and recovery. Let's look at where the scars are located for breast lift surgery. The important structures are the breast, the nipple, which is the bump, and the surrounding areola. One type of incision is called the periareolar incision, and this is a scar just around the areola. A vertical breast lift can be performed, and it includes both a vertical line as well as the incision around the areola. Sometimes what's called a Weiss pattern or anchor pattern incision is used, and this includes the incisions around the areola, the vertical, as well as an incision under the breast. One should consider a breast lift when the nipple or breast tissue are at or below the lower fold of the breast. Let's compare a breast lift to a breast augmentation. We can look at the amount of lift, the scar location, whether there is an implant or not, the duration of surgery, and recovery time. In terms of the amount of lift, a breast lift can moderately or even dramatically raise the nipple and the breast tissue, whereas a breast augmentation can only mildly raise the nipple. For a breast lift, there are more scars, including one around the areola, whereas with the breast augmentation, there are typically fewer scars. With a breast lift, there is no implant if the lift is done alone, and with a breast augmentation, there is a breast implant. In terms of the duration of surgery, breast lifts usually take 1 to 2 hours, whereas a breast augmentation usually takes less than an hour. In terms of recovery time, breast lifts vary in recovery from about 1 to 3 weeks, whereas breast augmentation recovery is usually about a week. Breast lifts do not alter your risk of developing breast cancer, and neither do breast implants. To reposition the nipple and add volume to the upper pole of the breast, an implant and a lift are often done together, and this is called an augmentation mastopexy. Now let's look at what you should expect with surgery. The surgery usually takes 1 to 3 hours and is done under general anesthesia. People go home the same day typically. A pain pump is available if requested, and often a lift is combined with other procedures. People are usually back to work in about 1 to 3 weeks, but recovery can be variable based on the extent of the surgery needed. Breast lift complications are rare but include delayed wound healing, infections, and bleeding. It is always important to have realistic expectations with surgery. Asymmetry means that nobody is perfectly symmetric either before or after surgery. There can be altered nipple sensation after surgery. And breast lifts turn back the clock, they don't stop it. With time and weight fluctuation, the breast will continue to mature normally after surgery. Please see the other presentations on our website to learn more about plastic surgery, or you can call to make an appointment to visit our board-certified plastic surgeons at 314-996-8800. Thank you.